To all the distinguished participants. Am I audible?
Yes, sir.
It is my proud privilege to participate in this important and prestigious webinar, which is being organized on the occasion of International Day of Yoga. This session for the celebration of 6th International Yoga Day being organized by All India, All Party Parliamentary Group on Indian Traditional Sciences UK will be a good approach for promotion of yoga and Ayurveda at the time of COVID-19. I am hopeful and confident that through the session, the current needs, obstacles, and also opportunities in the field of yoga, Ayurveda, and other traditional medicine will be addressed. As Ministry organizes International Yoga Day, an international conference on yoga every year, but due to pandemic of COVID-19 this year, webinar sessions would be more fruitful for explaining the role of yoga in mitigation of COVID-19. I am sure that the webinar will be a grand success and the participants would be immensely benefited. As we are all aware, yoga is the greatest gift of this country to the entire mankind. It has got a very rich tradition and culture. Yoga is deeply integrated in our day-to-day life. The declaration of International Day of Yoga by the United Nations Assembly has accelerated the activities and the programs of yoga for its promotion and propagation to a great extent. Today, the COVID-19 pandemic has put an extreme challenge for the entire medical fraternity. There is no proven cure for the disease as on today. Therefore, in addition to the measures such as social distancing, wearing masks, hand hygiene, enhancing the body's natural immunity has an important role in maintaining optimum health and thereby offering prevention from the virus. Government of India has taken many initiatives to contain the spread of COVID-19 by improving the immunity of people through AYUSH systems, including yoga as a prophylactic measure. Ministry of AYUSH has issued an advisory and has recommended self-care guidelines and preventive health measures to fight with COVID-19, which is available on the website of Ministry of AYUSH. India is the first country to promote Ayurveda, yoga, and other traditional medicine in the prevention of COVID-19. The ministry has, because we are all aware that whatever we are offering should be scientifically validated and should be scientifically proven. So ministry has constituted an interdisciplinary AYUSH research and development task force, which is headed by an eminent scientist and which is manned by scientists from CSIR and ICMR and other reputed research scientists. They have initiated multi-centric clinical research trials on four drug intervention, that is Ashwagandha, Yashtimadhu, Guduchi and Pipli, and AYUSH 64 in association with CSIR. So these trials have already started in multiple centers and this is progressing, and we are hopeful that this will be completed in a couple of months. In addition, Ministry has also offered nearly 8.5 lakhs AYUSH healthcare providers for the service of mankind, for the service of nationals in the mitigation of COVID-19. Their details they include AYUSH practitioners, AYUSH doctors in teaching hospitals and AYUSH hospitals, students, paramedic staffs. So all the state governments are deploying them for the management of, for the clinical management, surveillance, manning of isolation and quarantine centers. So their details are available on covidwarriors.gov.in. So all the details, they are well trained and they're trained by the staff of UNICEF, and WHO. So they are also having a trained manpower, and there are some self-running courses of Ayush also, which are available on igov.in, and all the practitioners, they are taking learning modules from these online courses. In addition, Ministry of AYUSH has developed an Ayu Raksha kit, which contains Chyawanprash, Ayush Quath, Guduchi tablets, and Adutel. And these kits have been provided to 1 lakh personnel of Delhi police who are on the front line of managing this COVID-19 in Delhi. And this is being already one first phase has been completed, and this is being monitored by our All India Institute of Ayurvedic Sciences. And additionally, CISF, Railway Protection Force, Indian Army, they have approached us for providing this Ayu Raksha kit because they find it very useful in developing the immunity system of the various personnel who are on the front line COVID barriers. So all these measures are going to be very, very useful in managing the COVID situation in the country. In addition, ministry has also paid special attention to the non-COVID care because of COVID-19 management, our mainstream health system is very much heavily burdened. So non-COVID care is also Ministry of Ayush is paying attention. They have opened 50 clinics. They have dedicated a portion of their hospitals for the non-COVID care management, the NCDs, for the management of NCDs. So that is also Ministry of Ayush. Similarly, our All India Institute of Sciences, All India Institute of Ayurvedic Sciences has been converted into Ayu, this COVID care hospital, and yogic and pranayam practices have become a very integrated part of providing various relief to the COVID positive patients who are being admitted to our All India Institute of Ayurvedic Sciences and other Ayush hospitals. So these are certain measures with which ministry have initiated. In addition, we know it's difficult for people to come to the hospitals. So we have provided telemedicine guidelines also. So Ayush doctors through telemedicine, they are providing services to the persons who cannot come to the hospitals because of this COVID conditions. So these are certain initiatives taken by the ministry. The ministry is also undertaking large-scale epidemiological studies to assess the possible supportive influence of Ayush medicines in slowing the spread and milder presentation of COVID-19 in India. The drug trials are going to be based on common national protocols, which would be followed across the country in multiple sites to generate robust evidence of safety and efficacy. I may also like to point out that ministry also is in touch with WHO for carrying out a population-based study in the country. And very soon it will be finalized. We are almost in the final stage. It will finalize, and in association WHO will be starting a public-based, population-based study for the management, for the effect of Ayush medicine in the COVID scenario. In addition, ministry has also launched an application Ayush Sanjeevani for undertaking a population study on the effect of Ayush advisory and the Ayush formulation in promoting health of people through digital platform. And we are expecting to get the feedback from nearly 5 million people, and we will be carrying out a study analysis of the data which will be gathered from nearly 5 million people, and we will coming out with a research study on this aspect also. In this webinar, members from European Parliament, from APPG, representative from UK and other country, yoga gurus, yoga enthusiasts, yoga professionals, students are participating. I'm sure all the participants will be immensely benefited by the discussion and deliberation in the webinar. I wish this webinar a grand success and hope that outcomes that emerges from this event may achieve the desired goal of vibrant health for all in the time of pandemic COVID-19. I especially compliment and congratulate Amarjit Bhamraji, who is taking a lot of initiative pursuing Ministry of AYUSH to participate and keep on updating us on the various initiatives taken in the United Kingdom for various Ayush activities. Thank you and Jai Hind.